Hello, my name is Dr. Nicole Meade. I am here from Otsuka's Medical Affairs team. Today we're here to talk about schizophrenia, so let's get started. So what is schizophrenia? Schizophrenia is a brain disorder that affects how a person thinks, how they feel, and how they behave. And it's really a collection of symptoms. You have positive symptoms, negative symptoms, and cognitive symptoms. And in terms of positive symptoms, what you think of with positive symptoms are psychotic symptoms, whereas the negative symptoms are more those of disruptions to normal emotions and behavior. And the cognitive symptoms you can think of as changes in memory or thinking and sometimes even language. So let's dig a little bit deeper into exactly what these pillars of symptoms are. So if you're thinking about positive symptoms, negative symptoms, or cognitive symptoms, depending on the patient or the person, they can range from mild to severe. And if we take a look at some of the positive symptoms, the first one you see here is hallucinations. Hallucinations are experiences in which it's a perception-like experience and one believes that they are sensing something that might not be there. There's no sensory stimulus there, but they might see something that's not there, feel something that's not there, taste something that's not there, and most commonly hear something that's not there. Another positive symptom you can think about are delusions. And delusions are fixed thoughts that may not necessarily be true, but the person cannot change their belief in those thoughts. Another positive symptom is unusual thinking. So one of the ways that unusual thinking is detected is when a person is speaking very quickly, moving from topic to topic, and are very the language is confusing and difficult to follow. So those are some examples of positive symptoms. Some examples of negative symptoms that you might see are reduction in expression of emotion. So not being able to appropriately express facial expressions that would tie to emotion, not being able to keep eye contact. Those are some changes in the person's, or the reduction in the person's ability to actually express the emotion. Another negative symptom we see is a reduction in pleasure. So something that you might once otherwise have had a lot of pleasure doing or, experienced pleasure around no longer exists. Another negative symptom is difficulty starting a new activity, not finding pleasure in that new activity. And the last negative symptom I want to touch on here today is reduced speaking. So not engaging in conversation, just an overall reduction in the amount the person is speaking. And then moving into the third pillar, the cognitive symptoms, this is where we see some difficulty in a person's understanding of information, difficulty paying attention, problems with memory. And again, we describe schizophrenia. It's a combination of these symptoms. And what you can see here is that these symptoms could be debilitating on the person's life. It can affect their work life, it can affect their social life, family life, and being able to stay in school. So depending on where the symptoms range from mild to severe, you can see it can have different effects on the person's life. So let's talk a little bit now about how common schizophrenia is. And when you think about the worldwide lifetime risk of developing schizophrenia, it's actually less than 1 in 100. If you want to think about the statistic here in the United States, it's about 1% of Americans that schizophrenia does affect. And it occurs in both females and males equally. Where we do see a difference is when the symptoms present. So it's a little bit earlier on for males, typically in the early 20s, versus in the females, late 20s to early 30s. So what exactly causes schizophrenia? What we do know is that schizophrenia is caused by changes in the brain. These changes can actually occur during development or fetal development when the baby's developing. And some of the changes that we see are in the structure of the brain as well as in chemicals in the brain. So we'll first talk about the changes that we see in the structure of the brain. Some of the first changes that we have noted in schizophrenia are the reduction in the number of brain cells. We refer to brain cells as neurons. So we have a reduction in the number of neurons. Typically, we're seeing changes between the connections of those neurons or those brain cells, and we're also seeing some changes in the size, shape, and function of particular brain areas. For example, the brain area that's in charge of memory, we might see some changes there in terms of size and shape. When we move into the chemical changes in the brain, the way our brain cells, those neurons, communicate with one another is through chemical messaging. Those chemicals are called neurotransmitters. And changes in some of these neurotransmitters, for example, changes in dopamine and glutamate, in GABA, those have been thought to play a role in schizophrenia. So that gives you an idea of, in terms of what we know about the changes in the brain and how that may cause schizophrenia or may be involved in the course of illness. But what are some other causes of schizophrenia? You can see here that several other things may contribute to the development of schizophrenia. You have genetics, family history, environmental factors that factor in. So let's talk a little bit about genetics. Twin studies have shown that there's some heritability as a risk factor for developing schizophrenia, at least partially. And it's also known that there are several genes that can be contributed to the development of schizophrenia in certain patients. There are environmental risk factors as well. So I mentioned before that it affects the brain and it can happen during brain development. So a couple of environmental examples there would be a serious viral infection during brain development or poor nutrition during brain development. And other environmental factors that may cause or play a role in schizophrenia could be something like cannabis use in adolescence. So those are some other potential causes of schizophrenia on top of the one that we discussed in terms of changes in the brain. So now that we know what may cause schizophrenia, how exactly is it diagnosed? Well, the diagnosis of schizophrenia is often complex. There are no laboratory tests that allow somebody to have a lab done and know whether or not they have schizophrenia. So what we do is typically a healthcare professional, a medical professional would do a medical examination. And what they're doing there is trying to determine if your symptoms are caused by anything else, like substance use, medications, or any other medical conditions. After that, you would then move into a mental health assessment. And what you're looking at there is the healthcare professional is assessing symptom duration, the severity of the symptoms, how those symptoms are affecting your daily life, as well as some of the timing of the symptoms. So for example, the timing of your delusions or your hallucinations. So taken together, that is how schizophrenia is diagnosed by a healthcare professional. Once you have a diagnosis, of course, you start to think about treatment. So how is it treated? We do know that there is currently no cure for schizophrenia. There are treatment goals in terms of controlling symptoms and overall functioning for schizophrenia. And the way that this is done typically and with the best long-term outcomes is with medication therapy in combination with psychosocial therapy. So medication therapy is a really important foundation in the treatment of schizophrenia. And there are a variety of different medications. The first that come to mind are the antipsychotics. You have the atypical antipsychotics as well as the typical antipsychotics. So atypical are the second generation, the typicals are the first generation. You can treat it with mood stabilizers as well as combination therapy. And then when you move into the psychosocial treatment component, there's individual therapy, which could include personal therapy, social skill therapy, vocational therapy. There's also availability of group therapy, which allows a little bit more of a social and interactive component when you're in a group of individuals. And we also have cognitive behavioral therapy, which has been thought to improve compliance. Now, in certain people who are have been unsuccessful or had not the best outcomes with the medication and the psychosocial therapy, or those with more serious illness, there are other options like electroconvulsive therapy. So those are really the ways in which schizophrenia is currently treated. So taken together, we're just wrapping this up here, a summary of schizophrenia. So what is schizophrenia? Again, it's a chronic disorder of the brain that affects how a person thinks, how they feel, and how they behave. The exact cause of schizophrenia is unknown, but we believe certain factors are involved, including changes in the brain, genetic factors, environmental factors, and family history. The diagnosis, again, there is no laboratory test that allows for diagnosis, but it is made by a healthcare professional after medical and psychiatric evaluation. And treatment, we have medication in combination with psychosocial therapy that The goal for treatment is really to manage symptoms and improve overall functioning. So that is our introduction to schizophrenia today. I hope you enjoyed today's presentation and information, and thank you for joining us.